The director of the CDC has split from the recommendations of the agency's independent advisory panel over COVID-19 booster shots. The Advisory Committee on Immunization Practices declined to endorse the Pfizer booster shot for all frontline workers. Regardless, the CDC is following the FDA's emergency use authorization of a third Pfizer vaccine shot. The FDA approved the booster shot for people 65 and older who received their second dose at least 6 months ago. It also authorized a booster for all adults at high risk of developing severe COVID-19 or who have frequent exposure to the virus, such as frontline workers. CBS News' Natalie Brand has more.
The White House says tens of millions of older and vulnerable Americans can now get their Pfizer booster shots. The president says he will get his.
The booster shot is free and easily accessible. Go get the booster.
President Biden's comments come after CDC Director Dr. Rochelle Walensky overnight signed off on a series of recommendations made by an advisory committee, agreeing boosters should be offered to people 65 and up. It will also be available to people 18 and older with underlying health conditions. But in an unusual move, she put back in the recommendation for a third dose to individuals whose jobs might put them at risk, such as healthcare workers.
As CDC director, it's my job to recognize where our actions can have the greatest impact.
Moderna is in the process of seeking FDA authorization for a booster, and Johnson & Johnson is expected to follow suit. The administration's health officials hope to make additional recommendations in coming weeks.
The FDA is working closely with Moderna and J&J to get and process their data as quickly as possible. This is a high priority.
But the top priority remains getting shots in the arms of unvaccinated Americans.
Listen to the voices of the unvaccinated Americans who are lying in hospital beds, taking their final breath, saying, and literally we've seen this on television, if only I'd gotten vaccinated. If only.
Anna and
we're going to bring
Sunny
you back later.
have to leave.
Yeah. COVID also caused a scramble on The View. Two co-hosts had to leave during the show after testing positive ahead of an interview with Vice President Kamala Harris. She did the segment from backstage instead. Natalie Brand, CBS News, the White House.
For more on this, I want to bring in John Moore. He is a professor of microbiology and immunology at Weill Cornell Medical College. Professor Moore, welcome. You have been on our show quite a few times throughout the pandemic. We are grateful for that. What are some of the major differences you are noticing in how people are reacting to the virus and the vaccine now, as opposed to when we first got news a vaccine was coming?
Well, there are two types of people in America. There are people who refuse to take the vaccines under any circumstances, and there are a large number of people who want as many doses as they can get every week, it seems. And this booster decision has been complicated and confusing for the past month. I suppose we're now finally going to reach some clarity. There will be some understanding of who will get boosters, under what circumstances, with what timeline. But it all tracks back to the original announcement that any American can get a booster in the near future. And that created expectations that it's like parents telling a kid's tea party that we have a particularly yummy cake and you're all going to get a third slice. Well, it makes it very difficult to tell some of the kids that you're not going to get a third slice. There's an expectation created. And it also gave the impression that the vaccines are failing when they're really not. The vaccines are still succeeding remarkably well in keeping people out of hospital and keeping them alive. And that's the main purpose of a vaccination program. So now, what are we hearing? There is going to be boosters for the over 65s, which is very justified because they are relatively at risk of severe COVID, and vaccine immunogenicity is lower in older people. At-risk healthcare workers and other professions, and we need to see the details of that. That also seems justified, although it did go against the advice of the CDC's advisory panel. And people with pre-existing significant medical conditions, and that's going to be down to definitions by their physicians, who may be put in difficult spots. If patients come to them and say, I think I need a booster, then it's going to be down to the physician's judgment as to whether that's really the case. And that could create tension between healthcare providers and their clients, their patients. It really does need as much clarity as possible in the coming weeks.
Well, let's talk about that split between the advisory panels and the agencies. Do you agree with the FDA and the CDC's decision to go ahead with giving frontline workers and those who are more exposed to COVID the booster shot, even though the advisory panels advised against it?
Well, I think everyone involved has extremely good intentions. No one is doing anything out of anything other than trying to do the right thing. And there are genuine differences of opinion. I listened to the FDA meeting last week. I thought the FDA advisors did a great job in reviewing the science, and they made a science-based recommendation. But when you move into the political dimension and this creation of expectation, and then the administration's leaders will see it in a somewhat different way. It's hard to criticize people for trying to use their judgment to do the right thing for the American public. So sometimes there are nuances, and you just have to use judgment and respect the judgment of those who are in the position to apply it. So, yeah, I would have gone with what the FDA advisors said, but in the end, that's not exactly what's happening. I don't think it's worth arguing about. We have to look to the future and get as many of the decisions right so that people who are providing the vaccines know what to do in the near future.
Right. So this group now that's being covered, this group that has frequent exposure due to occupational exposure, what will that, who is that? Those are doctors, nurses, and teachers? Who falls into that group?
Well, I would like to see the official definitions, but I think healthcare workers who are exposed to potentially sick patients is pretty much a no-brainer. If you're going to expand it to at-risk professions, they are genuinely at risk, and I know healthcare providers who really do want their third dose. Teachers, I think, are at risk because they're exposed to unvaccinated children, particularly in the 6 to 12, that age range in their classes. So I think that's justified. I'd like to see travel mandates introduced because TSA staff are going to be exposed at the security checkpoints to unvaccinated people going through the airports, and especially with travel surges coming in. Then what do you do about grocery workers who are exposed to the public on a daily basis? These are nuances that we really do need clarity on so that, again, the healthcare and vaccination providers can understand who is eligible, under what circumstances, what checks will be needed. But I think in the end, there's going to be interpretation is going to be biased towards inclusion. The administration clearly wants as many Americans as possible to get booster shots as soon as possible. Right. And I think that definitions will be drawn liberally.
And so, Professor, what about people who got the Moderna or Johnson & Johnson shot? Moderna has applied for FDA booster shot authorization. Johnson & Johnson has not yet. Do you anticipate booster shots will be available for people who received those vaccines?
Yeah. There's no difference in the science between Moderna and Pfizer, and J&J, in my mind, has always been a two-dose vaccine, and they simply need to go through the process of getting the approval, which is probably going to be done within a month or two. That's the kinds of timelines the FDA has received some data, will receive additional data, will review it in the same ways that it did for Pfizer, and it's very difficult to see that the decision would be any different. So those booster shots will come, the third dose for Moderna and the second dose for J&J, and I imagine the process will be very similar and the inclusion categories will be identical.
Professor John Moore, thank you so much for joining us. As always, we appreciate it.
You're welcome, Tanya.